we're expecting quite a few people, so I don't want to delay it too much. I think we're okay. Should we go for it? It's 9:31. Be the strict timekeeper. Right. Well, welcome, colleagues, and welcome to one of our very popular, I would say, collaborative master classes that we do through the Northwest Collaborative. So really pleased to have you here. I think the just judging by the amount of people coming into the room and the popularity.
You've gone on silent. I do apologise to interrupt.
Thank you. Not sure why I went on silent. Someone probably muted me, which is probably not surprising. Thank you for interrupting. It's a welcomed interruption. So anyway, colleagues, thank you for joining us. The audience, I think, is predominantly public services, NHS and social care. And if there is any colleagues from the VCSFE or any other sector, please do let me know. I don't want to leave anyone out. So it is brought to you, as I said, our Collaborative Masterclass partnership by a cast of thousands, but really dedicated group who bring these together on a regular basis. So you can see right there which colleagues are involved, ourselves included. I'm a director of Northwest ADAS. Probably should have. Did I introduce myself? Probably didn't. Vince Fraga. So Northwest ADAS, and really pleased and proud to be working in this collaborative with all these folks and being able to bring these master classes to everyone. I've been in post now about 10 months, and I've attended 2 or 3, and they're fantastic content, and I would say that, but you be the judge at the end of it. I think you will enjoy it. There's another slide, isn't there, Christina? So. For those of you who were wondering what you're coming to, I think all of you will know, but it is compassionate leadership in a pressurized, stretched landscape, supporting teams through burnout. So I say that I stress that that title because I think it is incredibly relevant. It is something we all know. We're working in much pressurized situations. The amount of kind of demand on services is ever increasing. The complexity of in the environments we're working in is there. The financial situation isn't getting any better. And a lot of that, in terms of the passion we bring to our work, gets tested on a daily basis. And at times, our leadership and leadership we receive isn't always where it could be because we're all kind of going through this. So this is going to be a fantastic opportunity to explore some of the things that we might be able to do differently, some of the simple adjustments we might be able to make, and also around recognizing what the signs are. I made the point when I was speaking to our facilitator, Sarah Jane, example of sometimes we're burnt out, but we either don't know it or we're working through that, and we're working in a situation where you're just not feeling it anymore. And I know that feeling, so it's something that I think is something that we'll be discussing. I think there's another slide for me, or is that it? Is that it for me? Okay. Well, without any further ado, I'm going to hand you over to Sarah Jane, who will introduce herself and tell a little bit about who she is and where she's come from, and then lead us in today's sessions. And then you'll get me back at some point in the session. But have a great session, everybody, and really pleased and thank you for being able to do this, and thank you for attending.
Thank you very much, Vince, and it's wonderful to join you all this morning and to see such a rich sort of I'm just looking at the chat and people introducing themselves and people coming from all sorts of roles and organizations, a real wealth of skill and experience in the room. So I'm delighted to be here. Thank you for the invitation. I've been really looking forward to today, actually. I had a call with Christina a few weeks ago, and just in terms of the interest from the collaborative, but also across the country at the moment around supporting compassionate team working. We all know it, that we're working in such a stretched and pressured context. And what I hope this morning's session, we only have a very short period of time, but what I'm hoping will support with is a really intentional pause for people. A pause to think about some of the impacts of relatively simple and straightforward practices that we can all apply. And often, as Vince was saying, the context that we're in can sometimes limit how compassionate we are in that moment. So we're going to talk about all of those things. But I think really this is, as I say, an intentional pause. So I lead a team-based working specialist organisation, Athena OD. Some of you, and I'm looking in the chat as people are introducing themselves, we have worked with, and we work with many of the organisations that you come from. I see someone's coming from the Isle of Man. Wonderful. But our work has been linked closely with that of Professor Michael West, and I'm sure many of you will know of Michael's work. And Michael was, in fact, our original co-founder, and he continues to be our consultant advisor. And I believe it's Michael's research and writing and his clear messaging about the importance of compassionate leadership and team working that was the catalyst for Christina to get in touch with me about joining you today. So, as I say, thank you for the invitation. And I know many of you will have heard Michael speak, so no pressure then, excuse me. But, you know, body language experts suggest that 90% of your impression of a person will be made in the first 4 minutes. So that's just 240 seconds. I need to hit the ground running. I suspect I've got less than 10 seconds left now. So I invite you then to really pause and bring your attention, not just to the content of the session this morning, but just to each other and also to how you feel and respond in the moment when we're talking about some of these things, because it will feel quite raw to some people, I imagine. But I want to be able to create a space where thinking is safe, where feeling is welcome, and very much compassion is the foundation. An opportunity to slow down. And when we work with teams who are often really struggling for all sorts of reasons, we say this is an opportunity to slow down, to speed up. It's an opportunity to slow down and really consider some of these things. And as I say, much of what I say won't be a surprise, but I'd like you to think of it as a prompt to pick it up and put it in your back pocket for a time that you might need it. And we don't get many pauses in our working days generally. So let's think together about how we can use this, particularly in this context of where pressure really just doesn't let up. So how are you doing? We know from our own experience, and particularly from initiatives that were running through the pandemic, and there was one, I don't know if we've got anyone from Eastern North Hertfordshire, but there was one in Eastern North Hertfordshire that looked at just how very simple, compassionate gestures can make a real difference, a profound impact on people's morale and well-being. Simple things like greeting people at the door as they arrive at work, or thanking them as they leave, asking people how they're doing, essentially. And we already know that compassionate leadership and team working, through decades of research, we know this, makes a real difference. Because when teams feel supported, when we feel supported and listened to, you know, we're able to work well together, and the benefits show up in all sorts of ways. And we'll come to that in more detail later. But we know that stress levels tend to come down. People feel less isolated, and they're more able to speak up when they are supported and listened to. So staff engagement improves. People feel more valued, trusted and connected. So over time, all of these things, and there's way more than just those two things, but this leads to better performance outcomes. So this really isn't just about how people feel, important though that is. This is much more. It's about stronger delivery. It's about better results. and improve financial performance. And we know that is a stress for many organisations at the moment. And all of this tells us something, and it's something Michael has mentioned in his most recent book. And I just want to interrupt myself to explain that I'm struggling with an injury to my chest over the weekend and spent many hours in A&E receiving very compassionate care. So if I look like I'm moving a little tentatively, that's why, but I'm fine. I'm dosed up and very pleased to be here, but I just wanted to share that with you. But yes, compassion, as I say, I can't stress it enough. This isn't just a moral virtue. It really is a strategic asset. It makes a significant difference. So valued, supported and psychologically safe team members, of course, we're more likely to innovate boldly. We're not worried about suggesting ideas. We stay committed to the shared goals if we know what those goals are, and I'll come to that later. And we're going to work more collaboratively. So my first question for all of you in the room, and it looks like we've got about 120 odd people in the room, is to ask how you're doing today as we move into this space together. Could you share one word and have a look at everybody else's words as they pop up in chat, one word to describe how you're doing or showing up today? Let's notice what's coming in. Overwhelmed, emotional, tired, flustered, spinning. Tired but good, juggling, multitasking. Great.
Sarah Jane, I'm not sure, I do apologise for interjecting, but I'm not sure it's in my hand up. We're unable to use the chat facility as external members, it's telling us. So just so you're aware.
Okay. So there must be some people that can't do that then. Sorry, who was that? I can't see. Was that Daniel?
Yeah, Dan Hobby from Royal Stoke.
Hi, Dan. And there must be a few others that can't use that. Apologies. It seems that most can. I don't know if that's something, Isha, you're able to support with.
I'll have a look at it now, Sarah, 1 second.
Thank you. Sorry about that, Dan, and anyone else who doesn't seem to be able to use the chat. We'll look into that. Thank you for highlighting it. Can you see it okay though, Dan?
No, we're unable to see it also, sorry.
Okay. So I'll just, while Isha looks at that, I'll let you know the sort of things that are coming in. John has just put gutted he watched the football. Yes, we're going to have to deal with quite a few people feeling a little bit lower this morning than they might have done. But we've got busy, pressured, happy but ready for the weekend, drained, on edge, fatigued, drowning, flustered, overwhelmed, another happy, challenged, tired, great, multitasking, lots and lots of different feelings. Thank you for sharing those, and apologies for those that aren't able to access the chat. We'll see what we can do in the background. But the person-centered work that you're all doing, and often you're supporting people, whatever service you're in any public service, quite often it's supporting people at some of the most difficult times of their lives, whether they're in an accident emergency, in social care, if you're working in voluntary sector. But it's a really difficult times often for people. So it's incredibly important that we pay attention to people's well-being, their morale, and not just the communities that we're serving, but our own and our colleagues, those around us. And this sort of check-in that I've just said, share a word, how you're feeling. Some of you may use that in your teams already. It's an absolutely fantastic way to start a meeting, and some people might think it's quite flippant. I will always start any meeting I'm chairing with a check-in, and the question can be anything, but it's about engaging people right from the start, to move from one space to another, and it has multiple purposes. So they're moving from one space to the other, coming into whether it's a virtual meeting or a face-to-face meeting or a huddle, whatever it might be. You're also getting an opportunity to hear every person's voice right from the get-go. and you're starting to learn things about people. One of the questions I might use in a check-in is, if you could bring anyone in the world to this meeting that would help us, who might it be? All sorts of questions you can come up with. People start getting to know other people, a sense of other people. But just from this check-in with 100 and odd people who may or may not know each other, we've got a bit of a sense of how people are feeling this morning, which we wouldn't necessarily have had before. We might have assumed something. So one tip is perhaps use a check-in at the beginning of any meeting or staff huddle. It may explain, and you can use it to understand a little bit of why someone might be behaving in a certain way, or what it is that they value or need in that moment. So thank you for sharing that. Isha, if any time you can give me an update on people accessing the chat, that would be helpful. This is a quote, and so from those check-in words that you've put in, it's kind of reflected here. So this came as a response to a Unison survey. This was called Your Life at Work, which ran earlier this year. And there were around I think it was just over 19,000 responses. And this was from staff working in healthcare across England, Scotland and Northern Ireland. And it included nurses, paramedics, administrative staff, cleaners, right across the board. But I want to be really clear here about the context that we're all facing, and Vince referenced it in his introductory words. In public service broadly and in health and social care, you are leading at a time of unprecedented demand, and it feels like unprecedented demand everywhere you look. So there's complexity, there's emotional overload, and leaders can sometimes feel that this is heavier than it used to be. It never used to feel like this. But what can happen is that if this continues, it's a continuum, and pressure outpaces capacity, and it can do that for long periods of time. And that's, I think, what we're seeing, this sense of this, actually, is there an element of this becoming normalized, this load that we're carrying? Huge challenges. Also want to stress, but this isn't unique to the UK. There are many countries facing similar crises. In Sweden, for example, and we're doing some work with some colleagues in Sweden around teams, but a couple of years between 2022 and 2024, almost 450 healthcare workplaces were inspected by the Swedish Work Environment Authority. And of those, 73% were required to take measures. And in emergency hospitals, 80% of the care wards didn't meet the requirements that were needed by the Work Environment Act. And I just want to quote, forgive me for reading, but I want to quote what came out of that inspection. And it said, the most pervasive deficiency concerns unhealthy workload, an imbalance between demands and resources, which has long characterised healthcare. So that was in Sweden. You could lift that and talk about it in the UK. So we're not alone. This is a global crisis around the pressures that we're facing. The World Health Organization estimates a shortfall of 11 million health workers by 2030, and 2030 isn't the far distant future anymore. So we have a huge number of vacancies. This isn't new to you. You're grappling with it every day in healthcare and social care and other public services. Around 100,000 in the NHS vacancies and over 100,000 in social care. And of course, the level of vacancies adds to the pressures. I referenced the financial pressures earlier on. Britain's public finances are under significant pressure. We've got public debt, which is high, borrowing, which is high, and government spending more on debt interest than in the past. Taxes are rising, and we're remaining under huge strain in public services, and the demand just continues to rise. So huge financial pressures. I've been visiting trusts recently where managers, the financial pressures are at the forefront of managers' work, and they are being tasked to save money. Don't use that building, or drop that service, or reduce your headcount. These are really, really difficult decisions for managers to make, who are sometimes saying, I can't cut anymore. There is nowhere else I can cut. Huge pressures. As I say, this isn't news to you. But with these, and clearly there are many other reasons, including the figures around people working additional hours are huge. The shift patterns that many people in public service have been doing for years. This workload I've spoken about, and this work-life balance challenge. So it's not surprising we're seeing increased and really unsustainable levels of staff stress. And then and as a consequence, what happens? Well, stress, anxiety, and other psychiatric illnesses, and I think we've got some people from that particular field in the audience today, these continue to be a leading cause of sickness absence across our services. So research shows in local authorities that stress and mental health account for roughly 30% of all lost working days. Social care and children's services are particularly impacted, and sometimes that can drive absence rates as high as 40% in those areas through stress and mental health. In the NHS, it accounts for almost 500,000 full-time equivalent days lost. And yes, mental ill health is growing. It's a growing issue across the entire UK. But what's alarming in the NHS particularly is NHS employees are roughly, and I'd imagine this isn't very different in other public services, but the data we have is for health. They're roughly 2 to 3 times more likely to require sickness absence leave for anxiety, stress and depression than the average UK worker. That's not right. And yeah, we can think back to those extraordinary pressures that many of you will have worked through 2020 and 2021. But this isn't about the pandemic. This isn't just about the pandemic. This has continued. The trends have continued post-pandemic, and we continue to gather enormous amounts of data every year, reinforcing this very uncomfortable truth. From the wave 2 of the Adult Social Care Workforce Wellbeing Survey, and I'm sure some of you here today will have been responded to that. So this was from late 2025. This showed that feelings of anxiety remain prevalent in the workforce at about 40%, 2 in 3, rating their anxiety as high. And that's consistent with wave 1, which was back in 2023, just after the COVID pandemic, when it was at 42%. The National Staff Survey for the NHS, which gives us a huge amount of really rich data, and it's one of the longest running, biggest surveys in the world. That now includes items derived from the Copenhagen Burnout Inventory, and you can access that. This is a standardized international measure of staff stress. It's open access. It's a valid and reliable instrument, and you can just Google that and have a look at it yourselves. But some of those questions from the Copenhagen Burnout Inventory have now been included in the NHS staff survey. And so what's that telling us? Well, what we can see is more staff report feeling burnt out because of their work compared to last year. So nothing's changing. It's getting worse. 31% of staff in secondary care feel burned out because of work stress most or all of the time. That's 31%. We also see a higher proportion of staff who say their work is often or always frustrating them, and that can be as a result of burnout. The data also tells us that 42% of staff have felt unwell as a result of work-related stress in the last 12 months. So these figures are alarming. And what we know is these people show up for work. They keep coming into work despite reporting that they feel unwell as a result of work-related stress. And then what does that mean for the service that they're providing and for their collaboration with colleagues and so on. In primary care, for example, this is a sobering picture around GP stress levels. According to the data, nearly 1 in 4 GPs feel so stressed they can't cope at least once or twice a week. I think we've got some physios in the audience I saw and checking in, but 40% of physiotherapists report feeling emotionally exhausted and 36 reporting full burnout. So that's lots of figures, but I just wanted to share the real context, because burnout isn't just about feeling a bit under pressure. This is a real syndrome with real health consequences. And this data isn't new. It's been there, and there's been a trend over a number of years. We have some people who specialise in this sort of work, I'm sure, listening today. So it'd be great to draw on their expertise in some of the conversations we might have as we go through the morning. But burnout is a term that's used to describe a state of physical, mental and emotional exhaustion, often related to workplace stress. And the World Health Organization describes it as an occupational phenomenon. And they talk about typically arising from chronic workplace stress. So this is stress that hasn't been successfully managed. The term was first used back in the early 70s, interestingly, to describe the exhaustion experienced by air traffic controllers in the US. And that was exhaustion in response to continual pressure and very long working hours. Much of our thinking now around burnout is based on Christina Maslach's work, and she recognises a syndrome with 3 components, and I've just put them up there on the slide. Emotional exhaustion, and while I'm going through this, I just want people to think about how they're feeling given some of those words that we used to check in this morning. Emotional exhaustion, so this feeling of being overextended, totally drained of energy. Depersonalization, or you could think of it as almost cynicism, if you like. So active disengagement from the job, from your colleagues, even perhaps negative attitudes towards the people and communities that you're providing a service to. And then this decreased sense of accomplishment or professional efficacy. So this loss of purpose and sense of achievement. And what we know from other research, and it was research Michael was involved in fairly recently, and some of you will have heard about these core needs at work around autonomy, contribution and belonging, the ABC of our core needs at work, all of which need to be met for us to thrive in the workplace. If we don't feel our bit is contributing to the whole, that lack of well, what's the point really? So these 3 elements of burnout have real consequences for staff health, behaviourally, psychologically and physiologically. We know it. When we've experienced it, and I suspect, unfortunately, many of us here this morning will have experienced some of these symptoms of burnout. Our concentration, it's difficult to hold our concentration. We have mood swings, depression, anxiety. We aren't as accurate as we should be, and this sense of withdrawal. And physiological, so we know that chronic work stresses are linked to a number of things: hypertension, cardiovascular disorder, diabetes, the list goes on. In 2015, a meta-analysis, so that's where we collect research from a number of different studies, and there were 228 studies that were looked at assessing 10 workplace stressors and the health outcomes. And they found that high job demand raised the odds of a diagnosed illness by 35%. Again, none of this will be a surprise. And it's not a surprise that what we're seeing is it's difficult to retain staff. Retention is a really major concern, particularly in nursing and in the early years of practice. And this is a vicious circle. If we don't look at the conditions and the organisational culture, it will just continue. So, you know, although there are government policies around attracting people into professions, we can keep pouring in this effort, but if the foundations are cracked, it just won't hold. So retention and how we create the conditions where we look after people, where they feel valued and they feel that they belong, is hugely, hugely experienced. Just thinking about, I just want you to think about this situation, and it could be any number of situations, but just this example, because I question if this sort of context is just becoming normalized. We've got so used to it. Let's say we've got a ward that's already under pressure in an acute setting. It's 8:15 in the morning. The night team are trying to hand over safely. The day team is short. Someone's gone off sick. All the beds are full. The discharge list hasn't been moved. The consultant's late on his rounds. And a relative has been waiting since before breakfast for an update. All of these different things. And then you've had a call from school to say your child's not feeling too well. Here's the uncomfortable question for leaders, for us to think about. In moments like that, do your systems help people pause? Do they help people listen and respond well, or do they actually amplify the pressure and cause people to go silent and make compassion even harder to sustain? So just think for a few moments. So when pressure rises in our systems, in your systems, do they produce compassion or do they consume it? If you want to share, and apologies for those people where chat isn't working still, but if you want to share in chat just any immediate thoughts on your system, do put that in. When pressure rises, do our systems produce or consume compassion? Anyone want to share their thoughts in chat? Oh, it's all gone silent. Is everyone still there? Consume it. It contradicts the verbal messaging. Phil, you consume the pressure. Okay, consume. Interesting, isn't it, that we'll see values on posters around an organisation, pinned up, shiny coloured posters that have taken many months to design, and with all of the best intentions. But in those moments, are those values being lived, produced? So it's not all consume. Okay. Thank you for sharing those. I just want to talk about these very quickly because none of this will be a surprise to you, but we can consider some of the common signs of burnout in these 5 categories. It can be helpful sometimes to think of these, but this is, you know, there's lots of different ways that you might want to consider this. So I'm just going to touch on it briefly. So there's emotional changes. So you might see this manifest in teams with the anger and frustration in ourselves around self-doubt and this sense of failure. Some of you put feeling overwhelmed, trapped, all of those things, and a loss of this sense of enjoyment at work. And then cognitive changes, so we might find it difficult to make decisions. That's important. So, you know, you're procrastinating a lot. Again, this comes from our lacking, you know, this self-doubt around, are we doing the right thing? Increased criticism and suspicion of others. Again, this plays out in teams. We see these interpersonal behaviour coming up when people are under pressure. You know, why are they doing that? What did they do that for? I did it, you know, I would have done it much better, etc., etc. What are their motives? And then a fear of making mistakes as well. Then there's physical changes. So some people find it really difficult to sleep. I'm sure many of us have found it very difficult to sleep in this heat. But then we're tired and we're going into work increasingly tired. But medically unexplained symptoms, you know, headaches, stomach pains, you know, increased vulnerability to infectious colds, coughs, etc. Then the social changes. So this sense that we feel that we don't belong, that we are isolating and we're alone in the world. And then behavioural. So, you know, we just don't seem to have a sense of humour much anymore. We're irritable, we lack empathy, and we might self-medicate with food, with drugs, whatever, withdrawing from others and perhaps neglecting our own personal needs. So I just want to invite you, you're not going to have to share this, I'm not with anybody else, but for your own personal reflection, I just wanted you to take a moment to think about yourself and to privately rate yourself on a score of 1 to 10. So 1 is very low and 10 is very high. And there's going to be 5 themes I'd like you to rate yourself on. And this is just for you to reflect on. So the first one is energy. 1 being low, 10 is high. How is your energy level at the moment? The next is workload. Rate your workload, your sense of workload. Now your sense of control. As I said earlier, one of the 3 core needs for us to thrive at work is around autonomy. We don't want to be just a cog in a machine. We need to be able to have autonomy to make decisions about how we work and the work that we are doing. So this sense of control. Then your sense of feeling valued. I shared some figures yesterday in a LinkedIn post actually around where we feel most valued, data that's come out of the staff survey recently, and it's very clear, and it's quite encouraging that I think it's over 70% of people feel that they're valued by their manager and by their team, but I think it drops to about 40%, this sense of value by their organisation. So your sense of feeling valued, and then finally, your sense of connection to the team. So Davina, we're just rating ourselves privately for you to reflect on. 1 is low, high is 10, around these 5 areas: energy, workload, sense of control, feeling valued, and connection to the team. So it's good to just recognise how you're feeling in terms of those 5 themes, but it's against this backdrop, you know, this continuing demand and stretched resources, that compassion is both essential and then at times really complex. The next thing I'd just like you to think about and hold on to, and you might want to jot it down, but I don't think you'll need to, because this will be something that's in your subconscious anyway. I'd like you to think about the best leader you've ever worked for or with, depending how you want to think about it. The best leader. How you define best is entirely up to you. But what I want you to think about is what they did that made it easier to do hard work well. What did that leader, or does that leader, if it's your current leader, what did or do they do to make it easier to do hard work well? And you might want to jot down 2 or 3 behaviours, and we'll come back to it later on in the session. Nearly all of us have a leader that we hold that was possibly the one that had a massive impact in a positive way on the way perhaps we've gone on to lead in our professional lives. So what was it, or what is it that they do well that makes it easier to do hard work well? And we'll come back to that. So compassion is an absolutely invaluable tool in our efforts to address some of these issues that I've talked about. And I didn't want it to sound all doom and gloom, but to present the reality of where we are now. And I wanted compassionate team working to feel much less like a slogan, but an evidence-based way of doing things. There are real, practical, simple things we as leaders can do and as team members can do every day. We can't do it 100% of the time. None of us are perfect, but this is something we can strive to do, making it much more of a way of working. And compassion, sometimes when I do quite a lot of these talks and we ask people, you know, how would you describe it? What words would you use? But it's fair to say, whilst that can be quite difficult, most of us will recognize it when we experience it. We'll all have a moment or moments when we've experienced genuine compassion in whatever setting. So we kind of know what it feels like. And I love this quote. So this comes from a book that was written by 2 clinicians. I've got the reference on the bottom there. It's a really practical handbook. It's called The Handbook of Compassion in Healthcare, but it can be picked up and used in any other sector. And I love it because it's true. At its most wonderful, it can leave a person feeling they've made the world a better place. What's interesting about that is that's about the person who is being compassionate. And at its bare minimum, authentic compassion can leave 2 people who are involved in it feeling they've helped each other in some way. And we'll come to this element of helping. Yes, Rebecca, we can share the slides. So contrary to what, you know, political leaders tend to believe, that, you know, the population is selfish and when things get tough, we'll go around raiding and all these sorts of things and rioting and looting. Actually, what we see in disasters around the world, whilst that does happen in pockets, in history, what we see is that people are compassionate. It's a natural human behaviour. If we see somebody fall in the street, we go to pick them, we go to support them. It's a natural instinct. And I think what's important is a first step for us all, because sometimes things come up around compassion and we have some interesting, you know, or it takes too long, or it's soft and fluffy and this is all very nice, and actually we need things to happen and we need structure and process, etc., etc. How can we change things? I would suggest the first step for us all lies in recognizing that we don't have control necessarily over the shape of the systems we work in and contribute to. We don't have full control, or indeed the societies in which we live. But what we can control is how we navigate through those contexts, how we respond to them, and then how we lead. And then essentially how we seek to be in this world. So it's about every action and every interaction every day. Just to pick up a little bit more around compassion and this understanding of what it actually is, because there is quite a difference between empathy and compassion. And I've used the word probably half a dozen or probably a dozen times by now. But take a moment to think about what it means for you. I said that most of us recognise it when we experience it. When I was in A&E over the weekend at like 2 in the morning, and we've all probably been there on the plastic chairs at some point, wondering when on earth I might be even triaged, 3 nurses came past me during that time, just said, "Are you feeling okay? We will get to you," to reassure me. They didn't need to do that. It was absolutely packed, but they noticed, probably because I was holding my chest, but they noticed. So how can we model this behaviour or value it when we struggle really sometimes to define it? At its heart, compassion is a feeling of motivation to act in the presence of suffering. So it's a motivator. And of course, it's associated with myriad religions and spiritual teachings. But the English word, interestingly, compassion, derived from the Latin compati, which means to suffer with. So this isn't about, you know, candles and cushions and yoga retreats and all of those sorts of things. This is about suffering, leaning into suffering. And what we know is that the reward center of our brain is activated when we're compassionate. So that slide I had just on the screen before, that at its most wonderful, it can feel like you've changed the world. So it is absolutely associated with the reward center of our brain. So what I'd like to do now, because you've heard me talking for way too long, is just, we're going to go off into some breakout rooms just for 6 minutes, something like that. They're going to be relatively small breakout rooms. And again, this is a moment just to stop and pause and reflect, to think about a great day at work and the not so great day at work. If half the groups, and I think Christina, you'll be able to probably tell people what, if we, does the number of their breakout room come up when people go into them?
I think it does. They should see. So I imagine we're going to have about 12, 13 different breakouts plus.
Okay.
So yeah, you should be able to see.
So if you're able to see that you're an odd number for your breakout room, what would be good is if you think about the not so great day at work. What are you seeing? What are you noticing about a not so great day at work? And that not so great day at work can then continue way beyond the staff car park when you go home, because you take it with you. What are you seeing and noticing? So those people in the odd number breakout rooms, and then in the even number breakout rooms, think about what is a great day at work. What is it that made it good? What were the interactions that were happening? What were you seeing and experiencing? And we've made the breakout rooms deliberately small so that everyone's voice can be heard. If you want to share what your sense of a great day or a not so great day at work is. We're not going to go around and do the whole feedback. We might take a couple of themes that come from those discussions, but it's your opportunity to share with your colleagues. And I think you'll find that there is quite a lot of similarities in your experiences. Main room. And as I say, there's probably too many of us in the room today to go round and take feedback. But you'll have probably shared in those rooms and come up with some common experiences about a good day and a not so good day. So I'm going to, if I may, share what's come up in these conversations previously, and I imagine it will be similar for you. But if it is different, do put something in the chat. But I am mindful of the time we have together. But generally, a good day at work so much is about the interactions that we have with our colleagues and with the people that we are supporting, if we're supporting in that sort of environment. The smiles, the connections, the laughter, the sense of control, the sense of autonomy, the sense of having achieved something. People talk about being able to tick something off the list. I actually did something, instead of the list getting longer and longer. None of those things take necessarily more time. None of those things are hugely technical or scientific. This is about human interaction often. It might be something as simple as being able to find somewhere to park, being able to get something to eat when you're hungry. All of those things are human needs. And then a not so good day. And ideally, I would like to come round and hear what everyone has to say. And it may be that we can somehow pick that up after the session. But a not so good day tends to be things that are out of our out of our control. One of the first things that comes up often is about IT difficulties, something that feels like, oh, not again. I just want to get on with my job and this hasn't worked, or the printer stopped working, whatever it is. Or we're not connecting with people. Things are frustrating us because we can't get things done. All sorts of stuff that actually makes us feel like we're not really contributing. We're just kind of part of a line of a process. So if you want to put any feedback in the chat, and apologies, Isha's still looking at it behind the scenes for those that are having difficulties. It seems that about 90%, I think, Isha, are able to use the chat. And so apologies for Dan and colleagues who haven't been able to. But if you want to put any feedback about that conversation, do put it in the chat. What I'd encourage you to do is do that exercise with your team. Find out what it is that makes it a good day at work for your team. And then build on those things, because often we don't ask the question. We are firefighting the things that make life difficult or sense that we have a bad day. Have the conversation with your team and see what you might be able to do. Really simple things supporting people's daily work. So if we look at compassion, you may have come across the work of Professor Paul Gilbert. Now, he's a British clinical psychologist, and some of you will be very familiar with his work, but he defines compassion as a sensitivity to suffering in self and others. And then the important bit is with a commitment to try and alleviate and prevent it. So it's, compassion is a universal value because it's experienced across all cultures, all backgrounds, and it doesn't matter what age, what ethnicity, what status, etc. It's a deep part, it's in a deep part of ourselves. But there are two things I just wanted to highlight. First, that compassion isn't the same as empathy. So empathy is the ability to kind of sense and understand what someone else might be feeling. But compassion includes action, and that's the difference. You can feel empathy and still do nothing. Compassion moves. And then the other thing I just wanted to highlight is that sometimes people say, well, it means that you don't have standards, etc. Actually, quite the reverse. Compassion and compassionate leadership is not about being nice all the time and avoiding those performance conversations. This is leaning in to suffering. It's not about lowering the bar. It's how you hold the bar, and it's how you hold it with clarity and support for learning. And we're all learning all of the time. So I want to step through the elements of compassion and then look at how this translates into our work in teams every day. And some of the core things that you can do in teams that we know from an enormous amount of evidence will make a difference. So the 4 elements of compassion, some of you will have heard Michael West talk about these, and that there are books. I'm not on commission, perhaps I should be, actually. I need to speak to Michael about that. But his most recent book around compassion in health and social care has loads of very practical tips and surveys and things that you can run with your team. But to be compassionate, we have to do 4 things. The first is attending. So this means being really present with the other person. And that doesn't mean that you're just sitting in the same room with them and you're having a conversation. There's a real difference. And when you're at the other end of it, you know it. When someone is really present with you, they're not thinking about what they've got to make for tea. They're not thinking about the fact that they've got 10 minutes to get to the next meeting, or what happened in the last meeting, or what happened in the corridor on the way here. They are present with you. And some of you will have heard of Nancy Klein talking about listening with fascination. When someone is attending, they are giving you their full attention. And it recognises, in that moment, you can recognise the pressure and chronic work overload that perhaps someone might be grappling with, noticing the suffering that they might be dealing with on a daily basis. But what can deter us from attending is often policies and rules and some norms that are going on in the organisation and the cultures, which actually can orientate us often unconsciously towards punishment. Someone is repeatedly late. Well, if we were attending and really being present with that person, we would want to be able to understand what's behind all of that. And that might sound like common sense, but how often are we able to do that and take time to do that? but then act. So there's a difference between, oh yes, you're late because you've got to get the children to nursery or whatever it is, but then something acting to alleviate or remove barriers around that suffering. So this listening with fascination provides a basis for the second element, which is understanding. So understanding the cause of the other person's pain or distress. And this isn't about me imposing my understanding or an understanding, but it's through a dialogue. So we get a richer and deeper understanding for both of us. And often, as I say, it's understanding that suffering is masked sometimes by missed deadlines and, as I say, someone constantly being late or errors. So this is about us learning to be curious, cultivating a positive default assumption that everyone is good and they're capable and they're worthy of compassion until we're until we need to understand anything different to that. Okay, so this is about thinking about somebody else's situation, what's happening to the person and why. And then the third is having an empathic response. So feeling the other's pain, but without it overwhelming us. So cultivating that capacity to attunement with those we work with. Being aware of that person, but simultaneously staying in touch with our own senses and experience. Understanding without empathy, though, can feel cold and clinical. And we've probably all experienced that. And empathy without understanding can actually lead to emotional overwhelm for ourselves or misjudgment. But compassion arises when both are present and they lead to action. So we're doing something to alleviate the suffering. How can I help? Helping or serving the other person. And we know a great deal more now about the difference that makes, the distinction behaviourally between empathy alone and compassion, this additional helping element. And the helping is something, it's spontaneity. It's not the off-the-shelf solution because every situation is different. It can be small, it might be checking in regularly to see how someone is, or it can be something about redesigning a whole service to reduce staff burnout that might be happening as a result of a process that we haven't really digged into and got curious enough about. But it has to be intentional. And it's not just kindness or sympathy. It's definitely this action. And neuroscience has shown us over the last 20 years or so that when we ask people to be empathic towards someone in pain or distress, that's associated with the pain sensors in the brain. You know, as I say, we can watch things, we can see things, we can hear things. And if we're empathic and we're feeling that sense of emotion of the other person, you know, we can feel pain and distress ourselves. But when we ask people to be compassionate, that's associated with the reward center of the brain. So the vast majority of us, as I said earlier, have been hardwired through evolution to be compassionate towards others. It's not some new skill we have. It's as human beings, we have a natural reaction to help. And in fact, Paul Gilbert references those three core emotional regulation systems. So one is our regulation system focused on dealing with threat. So that could be internal or external threat. The other is drive, you know, succeeding in our goals. And the third is about nurturing and soothing. So that is about compassion. So we have to ask the question, I suppose, why does this matter? And it matters because we're working in really complex systems, and these systems in public service often depend on discretionary effort. You know, people give so much. They often depend on people speaking up about injustices and learning from errors, and this really strong drive around cross-boundary collaboration. So compassion really matters. But the paradox, I suppose, is that under pressure, we often default to control. More targets, more checking, more escalation of errors, whatever it might be. Obviously, some control is necessary. But when control crowds out compassion, the system loses the very information it needs to stay safe. People stop talking. They stop talking about the error that might have been made for fear of blame. You know, and it's a paradox that control can do that right at the time we need people to be speaking. So one other thing that you might want to do in your next walk around or your huddle or your team meeting, and it might be in a one-to-one check-in, you know, often we will say, you know, what are the issues, any barriers that I as a leader can be unblocking for you. Actually, a question you might ask is, what's making it hard for you to do a good job today? What's making it hard for you to do that good job today? And where do you feel most unsupported right now? And then the important bit is to pause long enough to hear the real answer, rather than jump to the conclusion in your mind of what that is, what the answer is going to be, how you're going to fix it, blah, blah, blah. What's making it hard for you to do a good job today? So what we know, and I'm just going to touch on this very quickly, is the role compassion can play in healthcare particularly. And in complex social systems, you know, we rarely get the A to B proof that we want to see. But in recent years, there have been hundreds of studies looking at compassion in healthcare. These are just some of them. And you can see there's a book called Compassionomics. And I've got the reference there. And it talks about so many trials. Some of them are randomized controlled trials. So these are the kind of gold standard of medical research, looking at this first one, for example. This was a study by Jorge Fuentes and his team in the University of Alberta, and they compared treatment of lower back pain with conventional physiotherapy, and then treatment for one group had this plus enhanced compassionate care. And the result for the latter group reported that double the pain relief. But the study also showed that those effects persisted for 6 months. The second one, or the second bullet point there, was a randomized control in North America of patients with early diagnosis of non-small cell lung cancer. And they were randomly assigned to either a normal early cancer care or early cancer care plus, if you like, additional palliative care, early palliative compassionate care. And it was a study of the quality of life. And it was found that the early palliative care was associated with patients having a much better quality of life. And, you know, that's probably not surprising. But what was a complete surprise was those patients lived significantly longer. And that was backed up by other trials in Italy. And we see, you know, similar large effects around longer term disorders. And I've got some of the examples in there. What's really key to note, though, is that caregivers, so there's an inverse relationship with burnout. So it improves clinician well-being and lowers stress. And there's various randomized controlled trials there around GPs and nurses, how it reduces their stress levels when they are extra compassionate. I really encourage you to have a look at the work of Stephen and Anthony and Compassionomics. And there's also a fantastic TED talk. Stephen is a A&E clinician, and he talks about in his TED talk how 40 seconds of compassion can save a life. And you can just Google that, Stephen Tretiak. And he talks about, at the beginning of that, a bus crash in Sweden in 2007, where 6 people were killed and there were quite a number of survivors. I think there were about 50 odd survivors. But what he noticed and noted, and he talks about in that talk, is that 5 years later, when the survivors were interviewed, they remembered 2 things. One was the physical pain in the moment of that impact, and the other was the lack of compassion from the caregivers at the hospital. It stayed with them 5 years later, these 2 things. Do listen to that. He also talks about how using a script, and he reads out the script, and it's documented in the book as well, in a consultation, which took seconds, had a real impact on the person who was in the consultation. Really positive impact. There are 3 directions of compassion. We can feel compassion for other people, which we've been talking about. We can experience compassion from other people, which we've referenced. And there's the compassion we can direct towards ourselves. And we're sometimes less focused on that self-compassion. We haven't got time to do this today, but you might want to take a photograph of that QR code or look up Kristen Neff and her work on self-compassion. Kristen Neff, she is a pioneering psychologist, and some of you will have come across her work, and researcher. And she's an associate professor at the University of Texas and an author of quite a few influential books. One, Self-Compassion, The Proven Power of Being Kind to Yourself. But she was one of the first to define a measure of self-compassion scientifically. And, you know, she talks about self-kindness. So this being warm and understanding towards yourself, this sense of common humanity. So when something goes wrong, and I know I'm guilty of this, I tend to think, oh no, why me? Why my family? Why has that happened to us? Actually, just part of humanity, human life. It happens to everybody. Nobody's life is perfect. Stuff happens, and it happens to us all. And then this whole concept of mindfulness, holding painful thoughts and emotions in balanced awareness. So do have a look at that. It's a 26 questions and a scaled response. And she also has a fantastic video you can access on the internet. It's called The 3 Components of Self-Compassion. So in the last sort of 15 minutes or so, I just want to talk about how this plays out in teams, the critical importance of effective team-based working and compassion. So a great quote I have on my email signature actually is one from Michael West, and it says, "Our daily lives are shaped primarily by experiences in the teams of which we are a part." We've probably all either experienced it or have colleagues or friends who've said, I just don't want to go to work. I just don't want to go to work. The team aren't great, all sorts of reasons. We spend so much time in the teams that we're a part of at work. So we also hear, and I know there's people in the room today that I've worked with who are part of the most fantastic teams. And what a difference that makes to our whole lives. So effective team-based working. And we're moving more and more towards neighbourhood models, teams of teams. We're working with multi-team systems, a lot of the work we're doing at Athena currently. How we work together. So there are 4 levels of compassionate team working. The first is intra-individual. So without getting too scientific about these titles, that's about our self-awareness, our self-compassion, emotional regulation, doing that check-in. How are we feeling today? What do I feel as I had that encounter in the corridor, which wasn't very nice? And I'm carrying that into the next meeting with somebody else. Focusing on how we're showing up ourselves and therefore how we can be compassionate towards others. Loads more I could talk about self-compassion, a whole session in itself. And then there's inter-individual. So this is compassion between people in a team, actively listening, the things we've talked about, you know, attending, understanding, empathy and helping. And that's the foundation for psychological safety and trust in the team. And then we have intra-team. So this collective compassion, and this is the bit we focus a lot on in our work at Athena around effective team-based working. The shared values. What is it we're all here to do? Agreeing your team purpose. Does everyone even know what that purpose is? Increasingly, when we're working with neighbourhood teams, not everybody is quite clear what the purpose of the team is. Has anyone ever even spoken about it? Having our operating principles. Have we agreed how we will be together in this team? So that when someone is swearing like a trooper and others are finding it hugely offensive, was it ever Or has it ever come up to say, actually, that's not something we're ever going to do, just so everyone knows? Or, yeah, that's fine in our team. It can be as simple as agreeing 3 things you will always do as a team and 3 things you will never do as a team. And that's, quite a superficial example. The way you're going to be in this team so that people know the norms. And then when things change and behavior changes, you have a fantastic platform to be able to call that behavior out. Not on a personal, you're doing this, I said this, you said that. We agreed as a team that we would always come to team meetings. That's our priority. People aren't now. What's going on? Why are we deprioritizing? So setting your operating principles. We've got loads of stuff on our website around these sort of things that you can have a look at, access free, some of the research. And then inter-team. So organizations, systems, neighborhoods, teams, all collaborating across boundaries, recognizing the different pressures and sharing resources. So when we ask people, do you work in a team? The vast majority tell us, yes, they do. But when you ask 3 further questions, so 3 questions that tap into the very basic dimensions of team working, informed by academic literature and research, the figure drops dramatically. Does your team have shared objectives? Do you work interdependently, not sitting in the same room with a title of something team, or you've got the same line manager you report into? But does your work depend on the work of the others in the team? Do you work closely together to achieve those objectives? And then finally, do you meet regularly to review your performance and how it can be improved? So when 90% typically answer yes to the first question, we work in a team, less than half, so about 40%, can answer yes to all 3. And we know those 3 questions are fundamental to real teams if they can answer yes to those questions. And real teams have markedly different impacts in organizations. It's quite astonishing. There is a real difference in performance. And that's where we do a lot of our work. So these 3 elements characterize a real team: clear, shared and challenging team objectives, not 20 or 30, 4 or 5. Everyone knows them. You don't have to look them up, you know them. They're challenging because we know that if they're challenging, you're going to be creative and innovative. If they're just tick, well, what's the point? So challenging. And the second is role clarity and interdependence. The vast majority of the work we do with teams where we have interpersonal difference and behaviours going on comes from system and process, but often around role clarity. Who's doing what and why? How do those roles interlink? Who's dependent on that? If you pull on this, what happens over there? Why did she do that when it was my job? Well, perhaps that wasn't clear. So role clarity, really important. And the final one, reflexivity. But what we know is that when you just have the first one, clear objectives and reflexivity, so when the team meets regularly to review not what they're doing, but how they're doing it, stress levels can be 50% lower. That's simple stuff, but it can reduce stress levels by 50%. People know what they're doing and why, and they're talking about what's working and what isn't, and how they're feeling about it. The evidence from research is really clear. So we did analysis, there was analysis of health staff data over an 8-year period, and it suggested that the quality of team working across all sorts of settings, in healthcare, primary, secondary, etc., it reduces absenteeism, reduces turnover, it can reduce, it's linked to lower mortality rates, way more. Again, a lot of this research is on our website. Appreciate I'm running out of time. One other thing I just really recommend that you do is, we know that teams who spend time together reflecting on how they work can be 35 to 40% more productive. It needs to become a norm, a team practice, not the first thing that drops off when the pressure's on, but quite the reverse. What are we trying, not what are we trying to achieve, but how are we going about things? What's working? What's hindering that? And then finally, one objective for each team, for every team, should be how can we help you, other teams? Go to those other teams, assess what would be helpful, talk to them. Are we doing things that are helping or hindering how you work? So one of the objectives for your team should be, how can we improve how we work with other teams? I'm just going to put a link in the chat because there is some evidence, just see if I can put it in, around research we did when we looked at 1,000 teams that had just done an assessment of how they work together. And just by doing an assessment, improved their team working because they stopped and thought about, role clarity. Have I ever considered what anyone else in my team is doing? Do I know what our team objectives are? It's just a survey and 1,000 teams we looked at. And almost all of them improved just by doing a survey about how they're working together. So apologies, I've run out of time massively. I do like to talk, don't I? And that's my contact details. If there was lots coming up in chat that I was trying to multitask, but wasn't able to answer those questions at the same time as talk and move slides. So if you have anything you want to contact me about, please do.
I think it's over to me now, Sarah Jane. Thank you so much for that. That was amazing. And I think I suppose it was good I couldn't put the chat in because I would have probably been really obnoxious with the amount of things I wanted to comment on. And there was so much there. And I think for me, just a kind of a summing up and a few takeaways, that last bit around the inter-team, it really resonated with me. And I'm sure it did others. And I think that feels like a bit of a roadmap around how we work and how we can be mindful of that in really kind of feeling it. I suppose a couple takeaways to sum up for me is around, compassion is practice as well as a personality trait. And it's those daily actions and those little things that we do, listening well, acknowledging how people are feeling. It has a big impact. We can't underestimate that. The psychological safety, and I know it sounds like jargon, but it isn't to me, and I think it's really crucial to having that environment. And sometimes that's about not hearing what you want to hear, but it being done in a compassionate way. Recognizing when people are suffering and when they're struggling. And really a part of leadership and compassionate leadership is noticing it and looking at it and being curious about it. And I think the final one is, and I had this conversation with someone long ago, and I don't think I was really feeling it when I gave them my sage-like advice, but there's stuff we control, there's stuff we can't control. Some of it's so much bigger than us. We need to kind of concentrate on the things we have the kind of power for and what we can choose to do. Easier said than done, but practicing that and understanding that kind of the old adage around change the things you can and the wisdom to accept the things you can't. And I think that's amazing. So if you could do that, if you could do what we've asked on the slide, evaluate this, because I know I'll be evaluating it, and you can see by the enthusiasm what I'm talking about. It'd be positive, and I feel quite passionate about it. So please do. A bit of a plug for our next masterclass. If you like this, you'll love this one. So developing tomorrow's leaders, how effective leadership succession ensures we have leaders who can meet future challenges and do it compassionately. And I think this is just another fantastic opportunity. And I'll close now because we're on the dot for 11 and I'm never on time. So I thank you all for taking your time. Round of applause for Sarah Jane. A
Thank
round
you.
of applause for Christina, Aisha, and the rest of the crowd out there who's made it possible. So thank you all and have a great Thursday. Despite the result last night, this has given us probably a little bit of strength to get through the day. So